Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient which you had requested. The area of interest is the upper right quadrant, lower right, upper left, and the lower left quadrant. Now, the areas where implant placement is very difficult. Hence, what we've done is we've measured the ridges for our doctor, and then they can plan their treatments accordingly. We haven't placed implant because most of the ridges and areas or eventually spaces will not be able to retain an implant unless bone augmentation is performed. This is the panoramic view. Now this is the transaxial view of the upper right first premolar. This is grossly carious first premolar, which is also fractured, and hence this needs to be extracted. We've got, this is where the fracture is, and we have a radiolucency present here as well. So when this will be extracted, so the approximate working area will have a 7 millimeter of bone at the crest, 4 millimeter mid crest, and then 16 millimeters of height. This is the upper left 5 region for first premolar region, and here you can see we've got 7 millimeters of ridge width, 6 millimeters at the mid crest, and then you've got 15 millimeters of height. So it's very minimal. Only a very thin implant can be placed here, and hence because of that it is going to be extremely difficult to retain, because this is good bone for anterior region, but at the premolar region this is slightly less bone because it is in fact very thin. Moving to the region of the first molar, again here you can see, even though we have BTRs here, but we've got only 5 millimeters of ridge width with approximately 6 millimeters of height. So very minimal bone present here as well. This is the region of the lower right 4, and here we've got 5 millimeters of ridge width, 4.9 in the middle, and 7 millimeters at the middle of the ridge. We've got 14 millimeters of the height, but we do have a buccal defect, so implant placement here is possible, but you have to keep in fact that there's a 5 which is has a slight bit of a proclination towards the mesial, so there's not enough space for an implant here, but we've still gone ahead and planned the ridge so that a future implant can definitely be placed here. This is the region just distant to the 5. We've got 4 millimeters of width, 7 millimeters at the mid crest, and then we've got 11 millimeters of height. Again, we've got a defect here, so implant placement is going to be extremely challenging at this point as well. Moving to the now this is the molar region, the first molar region. We've got 11 millimeters of ridge width with 7 millimeters of height, so a short and fat implant can be placed here, but again the doctor has to plan accordingly. This is the region of the lower left 4. We've got 5.4 millimeters of ridge width with 12 millimeters of height, so this is an area which can definitely get an implant, because you can see here we've got good thickness at the mid crest level as well. So this is the region of the lower left 4, and now eventually moving to the region of the lower left 6. There we go. And this is the region of the lower left 6. We've got 3 millimeters at the crest, 6 at the mid crest level, and 11 of height. So this is the overall picture that we've shown our doctor. The only thing that they've asked is the prognosis of the upper right 6. So this is the transaxial view of the upper right 6, and here you can very clearly see that we've got the furcation is almost involved right here. So you've got very narrow furcation, so the prognosis does not seem to be very ideal in this case. So we will advise extraction and not endodontic treatment until unless the doctor really wants to save this tooth. Thank you very much.